Good evening, everyone. I'm your host, Dr. Anjum Qureshi, and I welcome you all for the third day of the Global Youth Festival 2022, being organized by IDYM Group of Companies. Our today's topic is Sustainable Development Goal number 3, Good Health and Well-being. To discuss on the topic, we have versatile speakers with us, Ms. Cheryl Ma'am, Dr. David Nabore sir, Dr. Monique Lynch Ma'am, and Dr. Adrian Desley sir. We always pray for having a good health. Our health issues may vary according to our age, and according to our gender, according to our climatic condition, and according to the geographical location. There are countries, especially the developing economies, which are trying to deal with issues like malnourishment, death of the women during pregnancies and childbirth, and death of the women, children below 5 years of age and newborn children. There are people who are pushed to poverty due to the financial burden which is being laid down to the expensive healthcare medicines. And there are people, due to poverty, they are not able to afford the healthcare. The issues are different, the challenges are different, but still we are working on the same goal. And this is the speciality of the IDYM, that realizing this, we have tried to uh, invite speakers from different parts of the globe to discuss our topic. And without taking your time, I invite the first speaker of the today's event, Dr. Monique Ma'am. Ma'am, please take the stage. Dr. Monique Lynch, ma'am, are you here?
Oh, yes. Oh, sorry. I was.
Okay, ma'am.
All right. Thank you for that introduction. Good afternoon, good morning, good evening, depending on where you are. So, on the topic of good health and well being for all, I would like to lay a foundation of what are the SDGs. So, to fight common global problems of human life, 193 countries agreed on 17 sustainable development goals and 169 sub-goals at the United Nations General Assembly. So basically, the SDGs are a compass showing the best routes for our desired designations. Now, the purpose was to come up with a set of universal goals that would help to combat the urgent environmental, political, health, and economic challenges facing our world. Now, the SDGs call on an intercontinental, multi-sectoral, and interprofessional approach for all businesses, world leaders, NGOs, public and private sectors to apply their creativity and innovation to solve our sustainable development challenges. Now, who are the sustainable development goals for? Once you are living on planet Earth, the SDGs are for you, and they're aimed at everyone: policymakers, civil society, businesses, academia, young people, each and every individual in every society. Now, additionally, along with the public sector, it is critical that the private sector and companies are involved in achieving the SDGs. Now, what are the main objectives? Now, there are four categories that summarize the 17 development goals, and these are stable economic growth, the conservation of national and natural resources, social progress and equality, and environmental protection. However, today we'll be focusing on goal number 3, which comes under stable economic growth, which is good health and well-being. Ensure healthy lives and promote well-being for all at all ages. Now, what are some key factors of this goal? Now, physical and mental health has an impact on so many aspects of a human life that it is so hard to address sustainable development without taking it into consideration. Now, in the last decade, significant progress has been made in improving several key areas of health. For example, the number of childhood deaths has been cut in half, But this proves that it is possible to win the fight against almost every disease. Still, we are spending an astonishing amount of money and resources on treating illnesses that are surprisingly easy to prevent. So the new goal for worldwide good health promotes healthy lifestyles, preventative measures, and modern and efficient healthcare for everyone. Now, while the goal in itself doesn't speak to mental illness in its entirety, newer mental health and health-related issues such as substance misuse, suicide, depression, anxiety, post-traumatic stress disorder are becoming a little bit more widespread. So let us look at some of the statistics since COVID from the United Nations. Now, COVID affected more than 500 million persons worldwide, which led to 50 million deaths, disrupted essential health services in 92% of countries worldwide, and halted progress on universal health coverage. Now, it also reduces the global life expectancy, the immunization coverage, and increased the prevalence of anxiety and depression, increased deaths from tuberculosis and malaria. Now, some 22.7 million children missed basic vaccines in 2020 and 3.7 million more than in 2019. Now, since the pandemic claimed the lives of 115,000 frontline healthcare workers, tuberculosis death rise for the first time since 2005. Now, under the goal number 3, there are 13 targets, but I want to zoom in on target 3.4, which states reduce mortality from non-communicable diseases and promote mental health. So this target basically states that by 2030, we want to reduce by 1/3 the premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. Now, NCDs currently kill over 40 million people a year worldwide, making up to 7 out of 10 deaths globally. Now, 17 million of these deaths are people younger than 70 years old and classed as premature. The great majority, which is 15 million of these deaths, are between the ages of 30 and 70 years. Now, the NCD Countdown 2030 report explained that the global goal to reduce premature mortality from NCDs by 1/3 is still achievable by 2030, but many countries are falling behind. So I did a doctoral thesis looking at the coexistence of non-communicable diseases and mental illness in 2 Jamaican hospitals using a mixed method approach with a descriptive cross-sectional analysis. Basically, the results of this study showed that there was a high prevalence of mental disorders, which I looked at depression and general anxiety disorder among NCD patients of 57.3%. It also revealed that 27.5% of patients diagnosed with depression in the study also had diabetes. 43.2% of patients diagnosed with depression also had hypertension, and 20.7% of those patients had general anxiety disorder, and 82.8% of persons diagnosed with general anxiety disorder had hypertension, and 19.1% had both. Now, NCDs with comorbid mental illnesses are a growing public health issue in Jamaica and a lot of low-income countries. Depression, anxiety, and/or general anxiety disorder are prevalent and undiagnosed in persons with NCDs, such as diabetes and hypertension in Jamaica and around the world. So what are some of the recommendations to government leaders? Now, the roles and responsibility of local governments to ensure healthy lives differ from country to country, but generally include: 1, making mental health a priority. And how can we do this? 1, The NCD programs in all countries should make immediate efforts to provide mental health care as a part of the holistic care package for persons with NCDs. 2, improving health governance related to inclusion, affordability, accessibility of basic mental health and physical health care through healthcare facilities and hospitals for all persons. And when I say all persons, these include minority groups, persons living on or below the poverty line, persons from rural communities, indigenous groups like the Maroons, provide training of basic mental health care to all healthcare providers, professionals, and workers, giving incentives to private sectors for incorporating mental health days, mental health leave for employees, and adding and covering therapy sessions under health insurance packages. We need to also include mental health in the curriculum at every level of educational institution and healthcare facilities, disseminating information about the dangers of substance misuse and the withdrawal treatment, providing recreational facilities such as parks, sports fields, stadiums, swimming pool, camping grounds to promote mental wellness, promoting screening practices for mental illness in patients with non-communicable diseases, maternity patients, amputee patients, cancer patients, HIV patients, because a lot of the medications given to these persons have side effects that if those are not treated, it will lead to a mental disorder. And last but not least, to run literacy campaigns to eradicate the stigma and the discrimination that is associated with mental health, mental disorders, and even NCDs. So in conclusion, how can we achieve this target? Ensuring healthy lives for all requires a strong commitment from all stakeholders. The government and the private sector need to invest more into holistic health, which is physical and mental health, by promoting health literacy as both a prevention and intervention strategy. The benefits of greater investment in health outweigh all the costs. Healthy people are the foundation of healthy economies. Thank you.
Thank you, ma'am. That was really nice listening to you. And there was so much of statistics that came out regarding the different issues. And when we talk about good health, it is not just about physical, that we also need to stress on mental health, because mental health is taking a toll of today. And in the last week, we were actually running a series in which we discussed so much about mental health, or the mental disorder, mental illness, whatever we call it, is increasing among the youth. So I would like to just like to ask one question, ma'am. What do you think is the reason for the increase in mental illness, and what can we be doing on our part?
Well, there's no one cause for mental illness. It's a combination of several factors, which can include the environment, nutrition, or social factors, environments that we are in. So there's no really one cause for mental health. But since the COVID-19, we find that there has been a spike in depression and anxiety because, that was a sudden pandemic that we didn't really were planning for. We weren't prepared. And I think that's what COVID-19 really revealed, that a lot of countries, we were not prepared. We're not prepared for disasters. We're not prepared for pandemics. So you find that a lot of persons who probably lost their lives, a lot of persons lost family members, they lost their jobs, they lost their livelihood, and that can impact your mental health. I believe that persons, we need to promote literacy, mental health literacy, so persons understand what is mental health, what is mental illness, what are the risk factors, what are the signs and symptoms. So when we recognize these, we can seek help, because that's another big part of mental health and mental illness, that we don't seek help when we need it.
Thank you very much, ma'am. It was really an interesting session and it was really nice listening to you. Thank you very much, ma'am. Thank you very much.
Thank you.
So with this, we call upon the next speaker of today, Honorable Dr. Adrian Desliso. So please take over the stage.
A warm and pleasant good morning to Everyone, panelists, thank you so very much for having me on the IDYM International platform. You know, health and well-being in our day has become a topic that is becoming more and more relevant to organizations. And the reality is that the lack of access to affordable, nutritious food and a poor diet can have a tremendous effect on the quality of life for the individual. And our distinguished, Her Excellency Honorable Dr. Monique Link shared on the Millennium Development Goals. And I always like to give a little backstory in presentation. The Millennium Development Declaration, which was adopted by the United Nations members at the Millennial Summit, took place in September 2000. It consisted of 8 Millennial Development Goals aimed to reduce extreme poverty by 2015. And after a wide review by international think tank organizations, non-governmental, governmental organizations, and stakeholders, this resulted in the refashioning into what we know now as the Sustainable Development Goals, the 2030 Sustainable Development Goals. And it consisted of 17 goals, 169 targets to ensure healthy human well-being, economic prosperity, and environmental protection simultaneously working together. And these set of goals are interdependent and provide a blueprint for global partnership between developing and developed countries to achieve economic prosperity, environmental protections, to safeguard well-being of people around the world. So what does that have to do with today's topic? Well, I am glad that you have asked me. One of the most important perceptions in our world is the understanding that we can no longer look at problems separately. We now have to take a whole systems approach to looking at problems. And that brings me to SDG 3, which is good health and well-being. But this goal does not operate in a vacuum. It has correlations with other goals, including SDG 1, for example, poverty reduction, hunger and health, the relationship between hunger and health, between food security and food insecurity, physical and mental health, for example. The outcomes in 2 ways. First, food and insecurity is associated with poor diet and nutritional deficiencies. Poor health and disability, in turn, can make it more difficult for individuals to obtain healthy foods. Food insecurity also is associated with poor health and educational outcomes among children, to name a few places. But this may be due to the fact that some people don't have access to healthy food. They don't have access to where they can find that food. According to the World Health Organization report in 2018, worldwide obesity has nearly tripled since 1975. In 2008 report, over half of both men and women in the European region, for example, were overweight. Roughly 23% of women and 20% of men were obese. Overweight and obesity contribute to many non-communicable diseases affecting the quality of life, significantly shortening life expectancy. And in recent decades, obesity epidemic has developed into something that, social systems, economic systems, cultural systems are beginning to look at how we can reduce the impact and the effect. Recognizing and tackling these issues is not a one system approach. We have to get our governmental organizations involved, the grassroots organizations. And mental wellness is, the ability to manage our emotions and thoughts, and also to remain in the present moment and bring harmony to our thoughts and actions. We have to talk about stress and how stress can play a major part in propelling us into places where we display poor mental health. So the importance of, I'm bringing a multifaceted perspective because, the importance of balancing work and life. maintaining healthy work-life balance is very important in the context of, working in your career. We are living in a time where career is the top conversation in every single circle. When it comes to time, we need to ask for help. We need to remember that we are only human. And when a person has a mental issue, we need to find a way to help that individual. And if you're worried that someone you care about maybe struggling with mental health issue, then it's important to engage them and engage someone who can find the help to help them. It was mentioned earlier by Dr. Lynch that, we don't, there's a general idea that, mental health doesn't happen to certain people. But I have learned, and even with issues going on currently within our Caribbean context of mental health, being called and asked to speak to issues, I realized that we can no longer sit back and think that the problem is going to go away. If you recognize any of the symptoms, it must find a way to recommend help for them, even an intervention if needs be. We also need to understand that we need to spread hope and help people to have hope in difficult situations, because after COVID, lots of people have not gone back to that mental normal. They've not gone back to that social normal. A lot of people have been left with holding the bag of transformation, trying to figure out how do they pick up the pieces of their lives after they've been ravished by COVID. And we need to also ask our governments to start to define priorities by establishing personal and professional priorities, developing realistic schedules and routines to help with a work-life balance. I saw that hand, Dr. Lynch. And educating ourselves in time management, managing our priorities, as well as managing our relationships. Because when we are leaders, sometimes we forget that before we are leaders, we're also human. We're human first. And we find that, sometimes you have so much busy schedule. If you don't have a control system, you can find yourself, blowing out. And yes, yes, doctor, we are human first. And this is a lesson I recently learned, that we are human first. And having seen, mental health reach itself into people's lives that you would never even think it would, like a 13-year-old girl, so we need to stop tabooing the subject of mental health and whole health, because if you have poor health, you're also going to have an effect on your mental health as well. We should never be afraid to talk about certain subjects that is not talked about in public, because people need real help. People need somebody there to say, look, you are not alone. Mental wellness training has to be incorporated into our society. And not just our society, but also within the culture of workplaces. We need to look at work-life balance policies for advisors. We need to speak to our governments about implementing work-life balance policies. How much work does each individual have to carry out, and what rest time do they have? We need to also look at cultural expressions of rest and relaxation that maybe come from East, for example. We need to find a way to improve our work life, because work-life balance is necessary if we're going to give each side in a compartmentalized environment our best. Work-life balance is defined for a person might be asking as the ability to fulfill family and work responsibilities. And sometimes when we are high career agents, we find that we don't manage our own mental health or stress within our environment. So how does poor work-life balance come into this conversation? Everything we do matters. The lesson that I am learning is that no matter who you are, mental health can affect you. And we need to bring persons in and have that honest, open conversation about topics of mental health and men, topics mental health and youth receiving and experiencing bullying in schools, and as a result, pushing them over the edge. Teachers being assaulted by students, and so teachers also going over the edge, and employers, being mean to workers. also pushing them over the edge. So I always bring a holistic perspective to the conversation. So I thank you so very much. I yield the floor. Thank you.
Thank you very much, sir. So it was like a very important point raised for you that yes, we are human first. And when you were presenting, even Dr. Monique ma'am said sent a message over here that was I was seeing there is no good health without mental health, and there is it is certainly a very excellent point. But sir, it has been seen that the increase in mental health it has increased in the last few years, but we can say after the COVID-19 pandemic, it has increased more. So can you just put more light on it? What is the reasons, and what can we be doing that way if there are such pandemics in future? We should be prepared for it, and we should avoid such kind of mishappenings and such kind of destructions that is happening. So please, can you shed more light on it?
Okay, definitely, Andrew. Well, to be very honest with you, we have been taught in society how to have compartmentalized lives. And so if I'm having a mental health issue, I think it has nothing to do with my work. And if I'm having a work issue, I think it has nothing to do with my home. But, you know, as a professional, what I see every day is this disconnect between what I am going through and what is happening in the world. What is happening in the world with climate change, for example, impacts my mental health. What is happening in policy impacts my mental health. So to answer your question, I think we need to be honest. We need to be honest about the reality of how mental health is ravishing even the youngest among us. How mental health is affecting when our parents become great-grandparents, and then they do not have the mental capacity to maneuver within a house, take care of themselves. We need to ask, how do we get doctors, lawyers, social providers, social services, police officers trained in mental health so that we can actually become a subset of the mental services where we are deployed in our own professions to offer help, so that if the mental health environment is overcrowded because the professionals don't have time, we should be able to empower our community to actually, who has time, especially our youth, to reach out to these individuals. We need to also look at understanding that education is a key. That if we can incorporate mental health into the educational curriculum, that we can actually make mental health something that we grew up with hearing about. Because when I grew up, I'm not sure about you, but when I grew up, mental health was one of those topics that nobody talked about. You were in school sitting next to a person who is displaying strange behavior, but you can't call it mental health because it hasn't been identified. And most of the time, the parents haven't even had the children evaluated. And so as a result, there's a social awkwardness going on within the context of the school, and that child gets bullied because that child can't say, I am having an issue that has been clinically proven. And so even the DSM module has been adding new prescriptions, new renovations to the idea of who mental health actually affects. And so I think we need a whole system approach to answer your question. Thank you very much.
Thank you very much, sir. And yes, it is the need of the hour that we don't consider mental health as a social stigma anymore. And we need to actually speak out, and we need to develop trust among the people, because there are people who know that they are under some kind of stress. They have so much of their pain inside, but they are not free to discuss with. They don't know whom should we go to, whom should we approach, and whom should we discuss with. If this trust is actually developed between us, whether they are our friends, our teachers, or our parents, so I think if the people come and speak about it, somewhere we can be helping others. Okay. Thank you very much, sir. Thank you for the wonderful presentation. Thank you very much, sir.
Thank you.
And with this, I take this opportunity to invite the third speaker, David Nabari, sir. Yes, please, sir. Please take over the stage.
Thank you very much, and hope you can hear me loud and clear. Hello.
Yes, sir. Please go on.
Yeah. So yes, this is David speaking from Ghana. Yes, having listened to my earlier speakers, I think I want to just go specific. Whenever I get opportunity.
Excuse me, sir.
to
Can you
present
just switch
to
on the
members-
video? Excuse me, sir. Can you just switch on the video?
Okay. So whenever I get the opportunity to speak on this subject, I look at the definition of health. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So in that very definition, mental health was categorically stated, and health cannot be complete without mental health. So I happen to be an advocate and a practitioner. I think, yes, we need to prioritize our mental health. And my topic given, maternity from pregnancy. So when you look at pregnancy, its associated issues, and mental health, there are a whole lot of issues we have to look at as partners, as advocates, as parents, and also as wives. So yes, what comes into play when we talk about mental health and people? First of all, we have to look at the culture of the people. So our culture actually determines what we do out there. Culture influences our nutrition and food, whatever. So when you handling some of things, understand the orientation of these people in terms of their culture, their religious background, educational background. Because when a woman gets pregnant, a lot of things happen. Some of them, they could be having a lot of challenges in their relationship. Who then comes into support? Are we there for them? Are we there to talk to them in terms of their emotional challenges for them to fix them? This is what I to the facilities. Yes, someone comes for A and C. You get to the A and C clinics, all that they are interested in is giving you the medication. Then you start to go out there. No. The best thing is that ask this pregnant woman, is your husband alive? Are you having all the support from your husband? The next session, can you come with your husband? Family support. Some of them, maybe their husbands are no more. They are deceased. So what we have to do is that even some have absent husbands. So all these things are something I say that in terms of mental health and maternity, maternal mental health is really important. And for us to be able to with maternal mental health issues. So maternal mental health policies should be promulgated. And institutions, stakeholders will be prioritizing maternal mental health. And this way, we are going a long way to address the fundamental issues that we have. We are always saying that mental health, the causes, biological, psychological, and environment, all these things all are centered on the environment. All these things are centered on psychological, but in the homes, family mental health support, where pregnant women are found. What can we do as advocates? You calling me here, I think all that I have to say, which will be brief, I don't talk much in this one, funding and invest into maternal mental health issues, whereby priority will be given to all pregnant women when they are pregnant for them to assess mental health. They should assess mental health care so that we'll be able to do our assessment and find out, do you have any challenge? If there are challenges, do we have practitioners and counselors available to attend to them? These are the issues that we have to have. We have to ask ourselves. If not, states, institutions, and our governments on the continent of Africa and in the Caribbean, like how our organization here is doing now, we should be able to steer our conversation towards this part. And doing this, I am of the view that we'll be addressing the fundamental challenges that we have in terms of maternal mental health issues. In fact, 1 out of every 5 pregnant women will have mental health challenges before he or she delivers or during her nursing period. So at those points, who then steps in? So I want to say that maternal mental health disorders are very common. Let us go out there. Creation of awareness is one. We should be able to ensure that primary health care, mental health assessment is integrated into primary health care so that when every pregnant woman comes at the OPD through the ANC, assessment will be done in that regard. For that way, will be, and also our husbands, we shouldn't leave them out of the scope. Men are really integral to ensure that women have the best mental health when they are pregnant. So we must bring the men into the conversation. We must ask the support systems the men will provide so that we will be helping our women there. Because almost all of us were born by women, with the males. So yes, what are we doing as males? Are we going to support them, or we sit down and allow them to go through some challenges? And before they even get pregnant, who impregnates them is us. So in as much as we impregnate them, we must also be in that capacity to stand in and support them during those challenges. Financial support, emotional support, mental health support, relationship support. Don't neglect them. Always be around. Provide all that they need and be able to ensure that they are never abused. We don't want you to abuse your pregnant women. And it could be financial, relationship, sexual, spiritual, whatever. So let us step in now, creation of awareness, go to the community, understand the culture of the people. Let's look at our religion. Let's look at our institutions, the schools, to also help us in the advocacy, so that a lot of people will get to know them, from our health workers to prioritize maternal mental health issues. So that we'll be able to identify some of these issues before they even develop into the conditions. I always believe that when you are able to look at issues when they are about coming, you'll be addressing them the better than allowing them to go into the disease state, to go into the chronic state, whereby money and even the prognosis will not be all that good for us. So yes, I am happy that we have great advocates, great practitioners from the continent of Africa and beyond in the Caribbean coming in now to look at mental health. And I know that tomorrow will always be the best if we prepare for today. So for us to provide that serene mental homes for our women, it starts from the very people who are in the homes. That is the men and women. Let's all women to understand their mental health. Let us go to the churches, the mosque, the various platforms that we get, and let us talk to them to be able to understand that when you are pregnant, the hormonal imbalances in your system actually let you have some kind of mental challenges. And those challenges, most of the times will be normal, but when it goes overboard, you must seek professional help, and we should be there to help them. So emotional issues are very common among pregnant women. Their nutrition will get destabilized. All these things all are issues because there is a developing fetus in the uterus, and therefore we have to look at how best to support these women at this age. On this note, I want to say that let's all of us be advocates for maternal mental health issues. Let's all of us identify early signs of maternal post-traumatic stress disorder, depression, anxiety. Some psychotic symptoms could even be seen in maternal mental health issues. And we should be ready, especially the puerperal psychosis, when they deliver. Yes, some of these things could be seen. When you see that a woman is not eating, they're having suicidal thoughts, tendencies, and all those things. No, this calls for action. Let us step forward. Depression is very common. Yes, as I said. So the support systems, let's go out there and look at them. Let us evaluate ourselves and let us support our women now. I saw that on the scale of depression, Africa was having the 6 leading countries in terms of suicide. Why? Because we are not looking at mental health issues. And now we have to look at this as a people, as government, as practitioners, for us to fixing our problems out there. On this note, I want to say a very big thank you to the organizers, and let's all go out there. As a mental health advocate from Ghana, on behalf of the Vinabwari Foundation, we are championing the cause of maternal mental health issues in Nkwanta South and Luti region. What about you out there? What about you out there? The question is to you all out there, especially those of us present in this assembly. Thank you very much.
Thank you very much, sir. Actually, you raised one of the points that I was waiting for since a long time about maternal health, about the health of pregnant women. Because if we want to ensure or we want to attain the goal of good health for everyone, so somewhere we have to look after the health of pregnant women as well. Because there are a lot of beliefs, the societal pressure, and some kind of superstitions where the people are not concentrating on the health of the pregnant women. And this is why we are getting unhealthy babies and the malnourished babies. So my question for you, sir, please can I ask a question? David, sir? David, sir, please,
Hello?
can I ask a question?
Yeah, I'm listening to you.
Yeah. So there is a question. Actually, this is a question which was asked by Monique, ma'am. Like, what are the risk factors for pregnant women? This is a question which has been asked by her. So you're mute. So please unmute yourself. David, sir, please unmute yourself. Sir, are you listening?
I can't hear you. Can you text me the question? Text me the question.
Okay, sir. So can you see the question? What are the risk factors for pregnant women? I think, sir, are you there? I think sir has lost connection. Might be some network issues on his side. So this, I think this
Hello?
is.
Yeah, so
yes, sir.
give me how much
Please go on.
How much? Give me 3. Hello. So what I think the men will do in terms of this one is to ensure that they get closer to the pregnant women, and staying with them will let them identify some of these signs. So yes, how do men deal with postpartum depression? For men to deal with it, they need to get close to the professionals, and that would be the best way. And also, we need more campaigns to be done in that regard, and that will help us to address some of these things. So I think we have to let them aware. Creation of awareness is one, because most are ignorant. That is why. And we should let them understand their cultural beliefs most of the times is what they use to subdue themselves. So I'm in a car, that is why. So sorry.
Anyway,
I think I'll send a good response. I'll send a good response when I get to the car.
Okay. So thank you very much. Thank you. It was really a pleasure listening to you. And yes, of course, like you were speaking about men and women, because men and women are two pillars of the society. And if you want a developed society, a developed nation, in fact, so so both of them should be given equal rights, and both of them need to support each other and understand each other in all the issues. And I think that David sir was the last speaker. And we have with us our reviewer, Dr. Bedkar sir, who in spite of his busy schedule always makes it a point to join us. So Bedkar sir, now it's over to you. Please, sir, please speak on this occasion. Please take.
Thank you, Qureshi madam. Daily you are here as a moderator and inviting through the IDYM group, respected Ravi Shankar sir, all the technical advising team. I am listening daily here different topics from the resource persons, and you are also organizing daily various topics. Today is the topic related to our mental health. If you see metabolization of our health of body, our mind or thinking always cause the effect on the health. And thinking starts from the brain, that is mental. If students are happy with their curriculum or their handling or their daily work, they can grasp more and more, and they will try to prove their merit in the academic session. On the other hand, if the students are discriminated, insulted, and not taken care, so that it gradually affects on the mental health of the students, and it gradually increases. And lastly, they try to lose their classes or hate the school. Without happening to this, the teacher of educator or the person which are in that field and in the school or colleges, they try to keep the atmosphere so healthy that everyone should enjoy the classes, the teaching, the curriculum and daily activities, so that students can acquire more and more knowledge. They can stood first or merit in the classes, and it causes a healthy atmosphere. It, because of the healthy atmosphere, it will cause all these things. So mental health not only just related to our problems in our school, but it also relates to the food and diet also. If the food and diet is healthy one, it keeps all the body, including brain, it's healthy. To keep healthy mind, a teacher or the educator which is with the students try to adopt some joyful activities, project activities, field visit activities, so that students can be interested to do that. And it will cause definitely the joyful learning and teaching atmosphere of the school, and they will get a sound mental health through that, and they will try to learn more and more through that activity. Thank you, madam. It's very topic related to us, and thank you for giving me opportunity to summarize to few points. I will thank you to the IDYM group and all the technical director team. Thank you, madam.
Thank you very much, sir. It is always a pleasure listening to you. We always like listening to you, and we really admire your efforts and your sincerity in attending the events and inspiring all of us. In fact, we were speaking about today was a session for SDG 03. We spoke about on the first day we were talked about poverty. Yesterday we talked about zero hunger, and today we were talking about health. So all the three sustainable development goals, if we see till now that we have discussed, they are interrelated. Because first, when that we talked about poverty, due to poverty, the people are not able to have proper food. And that is where the hunger arises. They remain hungry. They are not able to have meal, at least one meal a day. And from there comes a third problem, that due to undernourishment, they are not having good health. So all these SDGs are interrelated somewhere, and we really need to support each other, need to work with each other. And especially there should be like more stress. Most of us, most of the speakers, they talked about mental health, and one of the speakers like David, he spoke about maternal health. Again, that is very important, and awareness regarding to that, it helps a lot. Because I have worked somewhere at the grassroots level, and there I have experienced that when we provide awareness, it was not like that we just went and gave them some medicines or gave them some free of cost, but it was the awareness that has actually helped to bring down the malnourishment, which has actually helped to bring down the death rate of the pregnant ladies and the death of the ladies during the childbirth. And there was some, even though there are some of the policies that were raised with the government, but since there we have to come forward. That is more important. Well, coming to the end of the program, so ensuring healthy lives and promoting well-being at all ages is a requirement for a sustainable development. The medical field has developed new treatment, new medicines, and advanced diagnostic technique, but there is still a lot to be done. We need improved sanitation and hygiene. We need to provide more funding of health system. We require more number of dedicated physicians, and not only dedicated doctors, but we need more number of female doctors as well, because that is again a problem. Like the gynecologists, especially the skin specialist or the dentist, the female prefer going to a female doctor. So there is actually a need to increase the number of female doctors as well. And and of course the health workers, because without them we can't be achieving the goal. And so that we need all this so that a significant progress can be made to save millions of lives. And with this note, I take this opportunity to thank the speakers of today's session, David sir, Monica Lynch ma'am, and Adrian Desley sir. Thank you to all for sharing your knowledge with us. And I believe that we are surely going to bring this change and strive to work hard for attaining SDG 03. I also thank Dr. Bedkar sir, our reviewer who always inspires us. Thank you very much, sir. And special thanks to Ravi sir, Zeenat ma'am, and dear Dino Lasmi ma'am, and all